Hello guys, welcome to our third episode of Youth Baraza here at Let's Voice Podcast. I'll be your host, Amir Asmara. So today we are going to tackle the men's mental health awareness. So we are creating awareness to the men's mental health. So with me here, niko na several guests ambao tuko nao hapa. So a bit of round of introduction starting from Emily.
My name is Emily Njiriri. I am from the RedCross Society Mbs Branch.
Yes.
Hello everyone, I'm Dr Nur Said. I'm a pharmacist by profession and I'm pursuing my postgrad studies in dermatology.
Okay.
And my name is Akwabi Paul from Tech Kids Africa. I am a technology consultant and also a technology therapist for children who love using technology.
Okay, that was nice. So let's dive into the questions, starting with Mr. Paul Akwabi. So do you talk about men's mental health yourself?
Yes, but with a lot of struggle.
Yes.
Because I think the society has not given us that chance to be vulnerable as men.
Mm-hmm.
And at times, the more you're vulnerable, utaanza kuambiwa ulalamika kama mwanamke and all that. So at times you get, yes, I talk about it. And also in our organization, I've made it normal to talk about mental health. And actually, this is coming at a very, at a time whereby even in our organization, we have splitted teams into the girls team and also the boys team.
Yes.
To be just talking about the boys' issues, the girls' issues. And this is because we realize that if we don't create that safe space from just the organization level, then it is hard because sometimes even delivering of work on time and also ila watu kuchangamka na to be able to deliver, it affects the entire team. So sometimes you start wondering, why is Amir not really delivering? And yet we know him to be a person who really delivers work on time. So when we realize that we brought now the men being able to talk, we like knowing even where you come from. Sometimes we just come visit you. If you have a family, we want to know about the family. Sometimes celebrate even the kids' birthdays and all that. Also as men, because mostly we deny men that chance. Kama for example maybe ni kuingilia ladies kidogo, kama baby shower, hata sisi watu wewe tuuma kidogo. Yeah, we really feel like we are left behind, yet we need to really just be part of. And if we accept that as a society, I think it's going to also build. We've seen a lot of change in the performance, even in our organization, since we started actually implementing that this year.
Okay. So Emily, I think being at Kenya Red Cross, you interact with men's and most of them are youth. Do you think this is the real issue that should be?
Yes, mental health, especially for men, is really a huge issue. At the RedCross Society, I'll be specific with programs that we do. So tukiwa tunafanya certain programs, you find out most of the time even turnout. You find it's the ladies turning out more than the men. And we have issues, maybe we have a program that we also want men to indulge with. Utapata mwanaume wako tu pale. I think nile notion ama the stereotype that we have while growing up, ile hizi chama vikundi za wamama. Hizi kupiga stories sijui hapa na kule, tena ni za wasichana, ni za wamama. As in, we find sissy ladies, tunazitanga sometimes umbea, but not necessarily umbea. The more we speak, the more we share, the more kidogo tunaanza kureduce hizi stress tuko nazo. But for men, hutawapata kwa hizo kigeri wakiongea hizi story. Utawapata tu pale kwa hiyo base, wako tu hapo atakwambia bro, mimi sitakula lunch. Bro, mimi akona tu issues, but they do not even air them out. They sit hapo, they ponder wenyewe kwa wenyewe. We have cases where these men tuko hapo na wao, we are having activities. For example, even now we want to make them feel part and parcel of us. So we have team building activities, but you'll find them again when you tuko pale kwa on the front line for these team building activities. Sisi tena wasichana tuko pale na makelele zetu, oh, should you do this, do that. For them it's like isn't. They forget that even as much as laughing, just having this vibe sometimes is also a way of letting go. So yes, mental health issues when it comes to men is really something that we also have at the society as well.
Yes, Dr. Nur, I think moving forward, these organizations, many they look to empower women. So men are left behind. You think this is an issue that can be solved, or?
Yes, to be very on the middle, not to pick a side, but we've been leaning so much towards empowering the women and the girl child, and we forget that we cannot have a society without the men, because the society makes up both the men and the women. So it is a challenge, especially in Mombasa, like Emily has said. Vikundi is our mama. That is the biggest perception people have out here. And it doesn't matter the organization that you're tied into. As Red Cross, they see that majority of their volunteers as well are the ladies. You also see the same with Future Pillars, which is where I am the board of director at. And it's really a big challenge that we try to focus so much on the girl child that we leave the boy child behind. And I think personally, I've taken that up as a responsibility to try to fit in, even when we're celebrating the mental health days and women days or something, we really focus so much. The energy is just based on the women. Just last month, which was June, it was Men's Mental Health Month. But did we get so much noise about it as much as if it was the women's mental health?
I think that's the main problem. We make noise, we shout about the girl's child, but the men are being forgotten.
And it's very challenging. And I would say the challenge goes even to the technology. I hope Mr. Paul will back me up, because as you know, last month was Men's Mental Health Month. As an organization, Future Pillars, we try to do something for the men's mental health, and we, try to make the boy child happy, which is through what they enjoy most. So we picked football. Okay, we picked football to make it, to just advocate a day for them to feel happy and get their endorphins up and everything. But then, even when we posted it on social media, we saw the traction was so low. Yeah. The algorithm was not favoring it. So in my head, I'm like, how many battles are we fighting? Is it the community only or the technology as well? So we really have a challenge there. Yes.
So maybe to pose this question to everyone on the table. So what is really the biggest problem with men concerning mental health?
Okay, I think I go faster. Mm-hmm. The problem has not started today. You see, when we talk about men at the head, we shall say women at the neck, right?
The neck, yes.
And apparently, what needed to be invested in the head is being invested in the neck.
Yes.
Whereby ladies are going through the mental health activities and having that conversation about that. It's okay for them to feel vulnerable, but men are here who are supposed to lead. But they're the ones who are facing so much from just the society, the biological relationship out here. The culture itself is not really favoring a man, especially when you're stressed up and you're not able to speak. Now, like for example, just to maybe align about what you're saying about when you posted on social media about men, it's because already the society has that notion that men, you're supposed to be a man. You're not supposed to talk much about mental health issues. You're not supposed to talk about your stress issues. You're not supposed to talk about your personal things. You're supposed to be strong. Yeah? So already you get that the response that you're getting has nothing to do with technology, algorithms, and all through. The response you're just getting is naturally, people have seen. Yes. It's just that they have not reacted to what you posted, either by liking or commenting, because they don't have much to comment. And again, others have much to comment, but they don't want to. Sure. It's not a safe space. They start feeling like this thing might stereotype me. People might start discussing me maybe in a different way, or people have been believing I'm okay. So if I talk about this here, then I'll be bringing a different image. So it's something that we have not been used to, and we need to start maybe cultivating that within the society, but we haven't been used to talking about that. But again, I feel like as much as we are saying men need to also learn that, ladies are able to assist us in the same, because you are among our biggest fights actually when it comes to mental health. Yeah. So as the moment you're able to recognize that and understand men, we are supposed to be vulnerable as well, and we need also these spaces. Why am I saying this? When a child is growing, between actually when he is conceived up to around 10 years, 12, mostly it is the lady or the mother who's usually taking care of. So how is this lady trying to prepare this child to the society as well? So I think also that the way you just embrace a boy and a girl within the same society as when you're taking care of them is very important, as compared, especially in these times that we are in. So I think this is a question where something that ladies can champion about this more. First of all, you need to know you're more in numbers, and also the fact that you are created after us. You are the best version of human being. So you have more strength than how we are. And religiously, from my Christianity, is ladies are helpers. A helper is usually more stronger than the person who's being helped. But ladies have always thought that they are the lesser people, yet you are the stronger people here. Thank you.
I think to paraphrase the questions to the girls that we have here, how do you understand men, or how do you take as men? Because the notion is hamwezi tusaidia kwa sababu hamtuelewi, because sisi wanaume pia hatuelewi, so we tend to have that back and forth. So I think men, we are so simple that we want, but all we need ni tunataka kusikizwa, and that all. We need the same love that you need also. So maybe nyinyi una shida gani kwetu?
It's anchored in how Akwabi was putting it, how we were brought up as well. Tukiwa wadogo, live examples will be mwanaume akipigwa ama my brother apigwe sahi, unalia kwa nini? Wewe mwanaume ufai kulia. Mimi nikikuja nalia nitabebwa, mama pole. So from my upbringing, naona brother yangu akipigwa hafai kuwa analia. So mimi nikipigwa nikilia it's okay. Nitoke hapo saa ya kuosha vyombo sijui nini na nini, mimi ndio hizo nimepewa. Then naona brother yangu amepewa bebe sijui nyundo, amepewa sijui afanye vitu gani na so it's already anchored from my upbringing. Tunaambiwa charity begins at home. So kwanza tu pale nyumbani nishaanza kuelewa huyu mwanaume kazi yake ni ngumu, huyu hafai kulia, huyu nishaanza so hizi vitu zote zimeanza pale utotoni. So hata mimi kwanza kuelewa one, it's also now something so difficult for me to now turn the tables kuona hi Amir anafaa kulia. Amir, it's okay for Amir to cry, it's okay for Amir nimpate jikoni, it's okay for Amir to have hizi societal responsibilities that tumepewa sisi as ladies. But also on the other hand, ni sisi sasa ladies as well, nisema unless we are also informed, like what these platforms that we are having currently, ndio tuweze kuelewa this man, it's okay for him to cry. Emily, mimi paka wa leo, if I see, I've never even seen my dad cry, hata kwa mazishi. And maybe ni mamake amekufa, so I'm like, hey, adi mamako amekufa, like,
yes.
I'm like, okay, is it that bad for you to cry to an extent? You can not even grieve.
Yes.
And utapata hii grieve ataibeba ndo anatuletea nyumbani. Amesha jam, kumbe ni bado ako tu nayo hivi, lakini sisi ndio wale tunaitwa professional mourners.
Yes.
Tuko pale wanawake tumepiga nduru, tuko nini.
Yes.
So I think it's just ile upbringing. As much as we want, maybe mnaona hatuwaelewi, tutakuja kuelewa baadaye when it's almost even too late. Because Emily was brought up in a home where a man was doing this and a lady was doing this. So Emily grew up knowing all that.
Yes.
Akikuja kwa mkubwa ndio kidogo hizi platforms kadhaa nimepata, I'm able to understand, okay, it's okay if I see Akwabi cry.
Yes.
So I'm like, so it's something normal. Now it's where I'm now embracing the fact that a man can become weak. So I'll say it's not a problem that's sisi seti hatuwaelewi. It's just anchored pale kwa grassroots. Sisi wenyewe, mimi nikikuja kwa mzazi, I'll now have to, just nishajua, I'm now informed. Sasa niko pale nyumbani. If my son cries, I'm like, Baba, let it out.
Yes.
It's okay to let it out.
Yeah. I think maybe sisi wanaume question yetu ni ile rahisi, unaweza uliza mtu are you okay, ndio unapata mtu like anaanza ku sound ana breakdown like hivyo, but I think sisi tuko more simple way, si complex than women I can say. So sisi ni ile heshima na kumwangalia mtu kwa jicho lingine. Maybe to pose a question to Dr. Nur. So in terms of medical ama nini, so tuna understand sisi wanaume kwenda for check up mwanzo, it's a really struggle mpaka mtu hakuwa anabebwa na ambulance ama ndo nini ndo hapo anakwenda hospitali. So maybe how do you encourage men? I think for hapo ndo what vitu zinaanzia mwanzo.
Okay, what we have to understand is the health seeking behavior. So ile ability na the initiative to take up the initiative to go and seek healthcare outside your house and zile mitishamba and all is very hard for men. Globally, that's a fact. It's known that men have poor health seeking behaviors. So what we have to, the conversation we need to have right now is, why are men finding it a big challenge to seek out help, specifically healthcare, like, mental health help? Why is it a big problem for them? Maybe that's what we need to understand. Is it because they're scared they'll be shunned away? Is it because, you'd be perceived as less masculine?
Yes.
Unafaa wewe man up bana, hiyo uchungu ni kidogo, kwani hiyo headache ndio we need to question what is preventing these men from seeking help. And then after we've found out what the problem is, I honestly mpaka sahi najaribu kufigure out what could be the issue, because even you, Amir, right now, if you're sick, I'm sure it will take more than 10 phone calls from your mom, sijui 5 from your girlfriend, I don't know, your wife. A lot of people have to lobby you for you to take that step. Useme basi mimi nitaenda hata pharmacy, not even the clinic. I'll just go to the pharmacy, nichukue dawa ya to prevent that headache. Once we're able to find that out, then we can have an inclusive healthcare approach.
Yes.
Because for the most cases, like even when you see in our levels of hospitals, the ones that we have in the country, this level 2, level 3, which is what we have in the county, the small hospitals, the programs that are there are mostly tailored to women.
Yes.
I was very surprised. Around beginning of this year until May, I was posted in a small hospital huko side ya Kisauni, and every day from Monday to Friday, the percentage, I'm not even exaggerating, will have 99.3% women, and then maybe like mwanaume ni mmoja ama wawili. In a population that's like, in a hospital that serves more than 200 patients a day, you'll have only 1-2 men coming in. The rest ni wamama. So we have to have an inclusive approach of, even if they come to those facilities, some men are really trying to come, but wakifika pale, are they being included in those programs? Ama programs zote ni za wamama na kuvaccinate watoto, or we need to have that conversation as early as now.
I think the problem is jua sisi pia wanaume kwa wanaume, mimi nikiingia hospitali alafu ni wanaume anambia kudunga sindano matako, that is something that I have to discuss with my ancestors pia.
Actually, apart from even that,
yes,
ukiingia tuko hospitali kwa gate unaanza kusumbuana na uchi.
Yes.
Na wewe ni mgonjwa, because yeye haoni kama unaweza kuja kutibiwa.
Yes.
Yeye ana feel kwanza boss unataka
bado
hapa ndani kwanza unakuja kufanya unaona, lakini when a lady comes automatically una feel unataka kwenda kutibiwa. Yeah, so ndio kwamba ni society actually issue. And again, there's a question you're asking about why men do. It's hard for men to also show up, to open up and all that. You see, men usually have something called escaping. We escape from reality. That is, nikifeel stress, natafuta either nitavuta something on drug abuse and substance. So unapata hiyo nikishavuta kiasi nitakuwa kwa walidi yangu, nitarudi baadaye. Niko sorted. Now there's so many other different escapes that men use, and that is why you get that they don't end up now composing themselves and seeking just general help. Now all these also have push factors. Now most of the push factors ni nini? Unapata ni pengine pale tu nyumbani tu ule bibi yake, girlfriend yake and all that. I'm saying this because there is a story last year of a friend of mine, alikuwa mgonjwa, yuko hospitalini, ameadmitiwa. Then the girlfriend was having actually a birthday, na bado kama yeye ameadmitiwa. Then the girlfriend was expecting, hata kama wewe ni mgonjwa, ungetuma tu mtu an surprise. So you get that. Earlier I said actually they broke up because
of that one thing.
Yeah. Mimi bado ni mgonjwa, niko kwa hospitali, lakini wewe bado unataka tu
surprise.
Upewe surprise, at least cake uje.
That is unfortunate because emotions, they do not have a gender.
Yes.
Emotions are as raw as they come. They are for all human beings. So if I'm sick, I expect the compassion, I expect the empathy. You know, it shouldn't be hiyo tu as a woman, yani mwanaume ndo anafaa kunielewa, leo mimi ndio niko na cramps, leo mimi ndio, you know, I'm down, I have my down days and everything. It should be a both way street. So that is very unfortunate, and I feel like as ladies that is a challenge on us. We need to see men from that angle of they're humans in terms of their emotions, and anyone who's trying to get in touch with their emotions as a man, I feel like it takes a lot of the strength. So it shouldn't be shunned away or, you know, cooled off. In fact, hapo ndio nafaa ku encourage, niambie imekuaje, how you feeling about it, you know, you should.
I think maybe the reason as to why pia wanaume sisi we don't have the notion ya kuongea about our emotions, because hata ukipata hiyo mbona jani surprise, hata wanaume alikuwa kwa hapo sana anajaribu convince mimi niko sawa tu, don't worry, I've prepared something, so unapata. So we don't like amplify the aspect of emotions about tuko nazo.
Na pia something else maybe just to add on that, we might not really achieve a lot if, with the campaign of mental health with the already grown up men. So if we want to really make a change in the society and the next generation, we need to now go to the parental way. So we need to target more parents and more teachers who are also raising now the next generation. It will be much easier because right now you get, when we are from just the Gen Zs, but they on the street, ukiona wamejump paka wameingia kwa restaurant to take for themselves food, that's a mental health issue. It's because na kuna jirani yako na food angeenda tu aombe, lakini ana feel hiyo ni kujinitendekeza sana, mimi wacha tu ni in the street nani and then chukue food. So if we start from the earlier younger generation, we are able to achieve a lot by that as compared to now the current one. Right now unapata watu wengine tuna react out of trauma ile ya tangu tuko watoto, vile tume grow up, vile wamekuwa uncles zetu wamekuwa hawa believe in us kabisa. If they meet with you, kitu ya kwanza anakuuliza ulikuwa namba ngapi, ukisema namba 2 mbona si namba 1, ukisema namba 1 anakuuliza marks ngapi, for 50 out of 500 hizo 50 zilikuwa wapi. So umegrown a lot of trauma, and also even some of the achievement that you've made, you've not really achieved because of your own, but you're trying to prove a point. So today you are out here, you're a professor, you're an engineer, you're somebody big in a good profession, but you're not there because of your own. You have a push factor that was actually triggered by a trauma from your childhood. So this is something that is disturbing you. So as much as we want to talk about mental health and all that, kitu ya kwanza, hata hawa professions wako hapa hivi, ni wako pale kwa sababu walikuwa wanalipiza kisasi. Anataka wakuirich ndio majirani zao, ndio relatives wao waone. So there's a lot within this generation we're in, that yes, we need to make all awareness and all that, but we need to really emphasize and put more pressure on the parenting of the next generation.
I think Mr. Paul hapa amegusia how men tend to escape from realities, to use substance abuse. So I think how do we curb this? Because sign of recent watu wamekuwa pia ni high usage of bang na nini hizi drugs nini. and I think vile unaenda ni polepole, mtu hawezi kuambia why he's or watu wanaona tu ni sherehe, but in real sense they are escaping from something. So I think how do we curb this and tunawezaje kuepuka hii? Maybe
I'd say venye tumesema pale tukianza shule, wazazi and all that stuff, maybe I would anchor it to basically having these conversations a norm nyumbani and shuleni. Mtoto akichapwa shuleni, akikuja nyumbani, siku zote tunaambiwa usiwahi lalamika mbona ulichapwa shule. Mwanzo ukilalamika unaongezewa zingine juu ulilalamikia.
Yes.
And maybe it's something hakufanya homework because parents were fighting, si ndio? So to escape mechanism yake maybe sasa ndio hizo ameanza kutafuta wase wa jaba, beza jaba, ameanza kutafuta hizo places tu zenye yeye mwenyewe anaweza jitoa from reality yenye iko. I think if we'll have these conversations like shule imekuwaje, venye mnasema it's also hard for you people to speak out.
yes.
Because hata for men complimenting, unakuanga complimented on a daily basis.
No, that is yes.
Zetu ni fala hii. Somebody calls you something.
Gangster. Yes.
Even pale tu nyumbani like yes Paul, leo imagine umetoka shule, your mom is there listening keenly of how your day has been. Umechapwa shule, hana shida na hiyo kuchapwa. Ulichapwa shule mbona? Sikuwa nimefanya hivi. Na sasa unajua kufanya. You see kidogo huyo mtoto anaanza ku open up for issues. Hata kama alikuwa I'll give an example, my own example. Nikiwa na a friend in high school, I almost indulged in drugs and substance abuse. Alikuwa amenipea hii tunaikanga hapo inaitwa
tumbaku.
Anaita jina ingine nzuri.
Kuber.
Chavis. Vizuri. Sasa then I'm in school in Nairobi. Sasa amesema uko na vecha. Mimi pia nimetoka Mombasa, Mombasa ndo. Alafu sasa nimepata kitu inaitwa Chavis. Then kidogo nikitaka kujisikia msee wa ghetto nishaita vecha. Emily ashikiki hiyo time. So ananiambia hiyo time yeye ako tu sawa. Tumeenda funky. So sinaja funky nishachora shati yangu. Then I'm like sasa wewe ndio kale ka hot chick pale kwa funky. So ameniambia hii ndio inanisaidianga kama kem ushiki. Wewe dunga tu vicha kidogo. Kem.
Inadanda yote.
It has got nothing on you. So ndio huyo Emily nimechukua kidogo nasikia hapana. Naona tu hii dunia it's not the way nikasema ante jaribu nikiwa nyumbani kwenye kuna mtu anaona hizi niko nazo. So nikakula nikiwa nyumbani, nikiwa home nikatapika that day. After nimetapika narudi mama ananiambia uko na ball. Nasema nimetumia. So hiyo kitu nimeacha juu ya meza, my brother alichukua. My elder brother. So my elder brother, I don't know what was happening to him on that certain day. But sasa baadaye anakuja anasema this stuff unatumia kufiti. Kwa kitu za good. Mama namkelelesha alikuwa anatumia hiyo. Na mimi nimeacha hapo juu nimeona hizi kitu inanifaa. So baadaye later on it's when he's opening up and telling us how maybe things were not okay and akapata a coping mechanism. But if we were able to now speak to this person, tujue tu what is going on with this person, what is hivi na hivi, Akwabi, hey, your day has been good. Compliment Akwabi today. You're looking good, by the way. It's very rare for us even to compliment these people. So kidogo if as a norm, then pole tu mdogo we will even then be opening up. Finally yenyewe mimi hata
sawa. Tukishikilia hapo kwa compliment, I think mtatuambia kama tunakaa vizuri, so ili sipo tujisikie vizuri. So we'll take a short break and we'll come back. Asante sana.
Utakuwa na kiburi.
So welcome back. So tumetoka break, so tunarudi tena. Naanza na on my rights, Dr. Nur. So as a medical practitioner, labda tuambie the statistics and how are you going to curb the substance abuse in the coastal region? Ama how best are you taking steps? Because tukialama yote on how to solve it, labda tutambia the baby steps that you're taking.
First of all, tukianza na statistics za substance abuse. It's very unfortunate that coastal region is leading in terms of polydrug abuse, which basically means using more than one drug. Unatumia more than one drug either simultaneously or sequentially. And here concoction, the fact that we already know each individual drug that is abused has potential health outcomes, like very bad side effects to your health, to your mental health, and even societal. It can bring a big impact. But the fact that now you combine, you have a whole concoction of drugs that you're abusing, it's honestly very unfortunate because tackling it will need more than one approach. Haya, tukitoka hapo kwa the polydrug abuse, ukiangalia pia according to Nakada, they had a drug abuse report 2022, I believe. You see that alcohol abuse is the second, like in the coast region, we are the second one, like we are leading. So we can't really say ati Mogoka or, it's Mogoka, Miran, you're the only thing coastal people are using. Coastal people are using anything and everything.
Anything that can help people escape from that reality.
And ukiangalia, I like to deal with, studies. And there was a study done by some two brilliant students from Masinde Muliro. They conducted it here, Mombasa and Kilifi. They were trying to figure out what could be the problem. Why are people using these things? The number one issue was unemployment. Just the fact that they're idle and don't have anything to do.
Source of income.
It's the number one issue that is making them go. And they're trying to look for something to occupy their time with. Number two is poverty. Then huko chini kwa like number 8, I think, or number 10, the last numbers, you see the ease of access to these drugs that are being abused. So my solution, I would like to focus the solution on, we don't have a bottom up approach because it's not working. When you're trying to limit the access of these drugs, which is what our governor is currently doing, yes, it's a good initiative and we applaud him for that. But in terms of our priorities, we have them very messed up. Because if it's unemployment that is the first priority to be dealt with, then why don't we deal with that? Why are Mombasa youths just seated, wamesoma? Most of them are very proactive, doing a lot of things in their own organizations with their own abilities, but hakuna kazi wanapata. And at the end of the day, they're still going back to that poverty cycle. So why don't we have our priorities right and start with what is ailing the coastal region in the first place?
Yes, I think for that we capture unemployment that leads to nani. So Emily, maybe to paraphrase this question, as an organization that deals with youth and labda tuseme it has the right amount of youth ambao wanakuja pale wingi sana, sindio? So what are the actions that you're taking, ama what are the solutions that you're taking?
As in a RedCross Society, first and foremost, we have a toll-free number via mental health, where we urge anyone to just call any time of the day. Just call. It's 1199. Unapiga, we have certified counselors. You just speak to them anytime, whatever you have. Sometimes they even, you can have people call. Amepiga tu alafu akakata. They follow up as well, because ule mtu kupata tu ile stamp ya kupiga peke yake, obviously alikuwa nakaa. Kuna mwenye anajaribu tu, then kuna mwenye anataka kujua, anataka afuatwe, maybe ndio somebody to now probe these questions to them. So we have that toll-free number. As well, we encourage people to come volunteer to our organization. Tumesema unemployment is an issue. And as much as unemployment is an issue, we all know easy job adverts zinataka 10 years experience. So do 15 years experience. So atapata wapi hii experience? We encourage them to volunteer. We come there, we have a lot of programs that we do also as young people. Wakikuja, we give them these skills. Let them come, not be idle. We have a friendly space, watakuja, we have different trainings that we take them through. At least achukua hivi idol, apate ile experience. At the end of the day, they also want a recommendation.
Yes.
So tunajua, as much as we cannot give you a job, lakini we can give you skills zenye zitakufanya wewe uwe competent in whatever field that you have. That is now as an organization. So we also prioritize specifically for men. Last June also being the mental health month in men,
Yes.
we also had a treated spaces for men.
Yes.
We have these same conversations where our panelist was even more of men.
Yes.
Men were speaking, telling us what their issues are. Again, after we've taken up what their issues are, we also tend to, most of the time, we just love following up about our men pale kwenye Red Cross. Unafanya, we actually even brought a cake for the men. Tukakaa hapo, wakakula, alafu kidogo wakasema, ile like, ni leo tu. These people are not even used to hii kitu. So it's something we have to make a norm. Si lazima June peke yake. So it's something that we also now want to start practicing as an organization. Let us embrace these men that are there. Let us embrace any time they are there, whatever little they do. Na vile nilikuwa nasema story ya compliment. We want to start it also as an organization level. Akikuja pale akivolunteer, they give out, it's totally free. Hatuwalipangi kitu. Lakini amekuja pale akapitch tent. Uko like, enyewe you've done a good job. You've done a very fantastic job. So we're just there to ensure like our volunteers who are there also appreciated. We give them skills. We follow up in whatever ways we have possible, whatever connections that we have that is a platform or a plus to them. We also ensure that they get that.
Maybe labda mimi ndo sikuona ama mimi ndo niliona. So I think last year you had the session ya Lucid Talk. This was muchly encouraging people to come and open up. So maybe labda weza tuelezea vizuri ama do you still have the program ama?
Yes. So we started something. Actually, it's a man who started it. Now, kudos to that man.
Yes.
So alianzisha kitu inaitwa Lucid Talks. It's basically wenye tunapenda ngoma, kuna hii ngoma ya Lucid Dreams. So it's also something that lucid just means expressing yourself freely. So akaanzisha something we call Lucid Talks, where we just have young people. We have counselors tuliwaleta on board. They just speak to them freely. It was entirely free. We were doing it from 4 to 6 p.m. So we just come, people speak out, people were sharing to an extent. We were also surprised, like, okay, we didn't know that this is a program that really was needed here at the RedCross Society. So it is a program that is also still ongoing, where even after we have done a group therapy, after that you have one-on-one also with these counselors, totally free of charge, because we also know psychologists now, pesa nayo ya kualipa.
That's another problem by
yes. So we are like, we understand that as young people, even men, hawezi afford maybe hii pesa ya kwenda kuona psychologist. Why don't you have this psychologist on board when you wanaweza fanya for free? So this is just a program that, yes, it's ongoing, and whoever is interested also to come and join the Lucid Talks program is welcome.
Yes, maybe kuja kwa Mr. Paul. I think watu wengi wana isolate tech, mental health and the whole genre. So maybe how do you tailor make it to
actually, before I just go to your question, unajua tunaongelea mental health. I've been just thinking too about all that, and you see, even right now as we're talking, our president is a man. Sahi, boss, we need psychologists to be around this. He's going through a lot.
Yes.
And we need to admit that. So, kama tunaongelea, I don't know if this is the right platform.
The
president needs to know that he needs help. Right now, we know that. And also the counselors, psychologists need to also, and psychiatrists need to know this is a time also, as much as we want to help the society and even the youths that are out there trying to demonstrate. I think also our leaders, we have MPs wenye wamechomewa makwao, saizi wako recess, wako holiday, lakini they cannot go home. Thus, this is, first of all, for a start, it is a business opportunity for especially youth when you're that particular profession. And also for them, just look for these leaders. I think they're going through a lot, and we will blame them for making wrong decisions when we are the ones who have given them that pressure and never also aligned within a way of assisting them. And this is for you, Dr. Nur. Kindly make sure our leaders are on mental health check, including our governor here. I know at times we are not really easy on him and so many other ways. I'm saying this just because of the mental health. At times we assume that it is for those youths who are really suffering, because once the governor's mind is okay and the president or other leadership also, then we're able to get them thinking about getting jobs for us. And that will be also halfway at least solved. And we're able to have that as a conversation.
I agree with you. And it trickles down to our governance, governance system. Because Kenya is a very powerful state. We even have a Mental Health Act. I hope you guys know that. We have a Mental Health Act. I think it's Cap 248 or something. And the act is very thorough in terms of how when somebody is struggling with mental health, what happens to their properties. I don't know, the state gets what, who holds the share of this person, who makes this decision for this person. It's not tailored to how exactly are we going to help this person. It's more of how exactly are we going to figure out where the wealth of this person is going to go.
But that's where now you come in, Dr. Nur. Yes, you need to be advocating for this, and we'll be there. For the change to be there.
You can go for money haste.
You know, it's a big challenge. Like when I looked at that Mental Health Act, and surprisingly, I was reading it for my board's exams. You know, to be qualified as a pharmacist, you need to go through the laws and everything. So when I was going through it, I'm like, okay, where's the mental health aspect of it? Like, it's not so substantive compared to the other aspects of the wealth. And, you know, the wealth part is, it stands out very clear. But the fact that how many mental health institutions are we trying to, you know, bring on board?
Because the government has an interest on the wealth.
On the wealth.
Actually, that's the reason why we were on stage for financial bill, because they want just to tax anything and everything. When we have a problem with our mental health, they want to tax that. They want to get what are they getting at the end of the day. And actually, also with Emily, right? Because I think mmetusamea you keep on saying vile time ya maandamano watu walirushia gari zenu but I think also within that time you are rescuing people when mnangoja wanashutiwa alafu ndo mnawasaidia kuwaponya. Very nice, very good. But wale wenye bado hawajashutiwa, mungekuwa na tent kando ya mental health. Unaona hii kitu ingesaidia kidogo. Hata pressure ingerudi down. Then wasio wangesema mazee, nafikiria turudi to home ama tuko to very peaceful. Something maybe like that. Okay, it's just an insight, but I understand when in that time we don't think much about maybe them. We think more about saving the lives that are in danger. But those are some of the things we need to be discussing and having ideas of how to really relate even more. Because I feel ingefanya something. Youth wanakuja and then mnakuwa tuna some mental health discussion tu vizuri. Una realize your pressure ingeenda down. Then wanaamua, look, I think hii street tunahitaji kuchange strategy ya what we are doing. We don't need to break anything. Maybe this is how we need to really engage. Then earlier on, I'm coming to, you asked me a question offline before we started. Swahili poti ilitushinda mabao ngapi? Tulikuwa tunacheza football. Nikakwambia ni friendly, but okay, fine. We partner with Swahili Pot a lot just to answer what we're doing. This month on 27th of July, we are cycling actually for mental health, and this is in commemoration of there's this young artist who took his life. Actually committed suicide because of so many stress that he had, and he was a very good instrumental artist at Swahili Pot, yet no one knew what he was battling. So there's a lot happening within the youths, and I get that we are in that space. We are cycling, actually fundraising for a robotic kit that have been locally manufactured, and we'll be cycling from Mombasa to Nairobi from 3rd of September, and we'll be arriving in Nairobi on 12th of September. And but before that, we're having build-up events, and one of the build-up events is we're championing for mental health. And on this mental health, you get that most youths, you get that sometimes they're really overwhelmed, and we are trying to also come in through as an organization to see how we are participating within. And I think, I hope this, within this conversation, all of you here will be there. Dr. Nur, I'm expecting you to be there. And also Emily from RedCross. I'm really expecting that actually as we handle this year.
Just to answer, as a medical practitioner, what I have done. To be honest, my biggest, I can say, like, what made me realize I need to take a step was last month when we were having a discussion. I think we were having it with you, Amir, on what can we do for the boy child. And the mandamano was really on its peak, you know. And okay, I was a volunteer. I still am a volunteer of Medics for Kenya, which is a group of a bunch of medical practitioners that came together to just be there for Kenyans, to support, to give them the medical aid during these demonstrations. And I like to give a shout out to Kenya. They're called Kenya Psychologists Association, KP, I think. They have really come out with numbers, toll-free numbers, you know, to try and give that mental health break to guys, especially those who have really been affected. And even as medics, you know, it really got a toll in us. I mean, personally, I was being aimed at from the back while trying to dress up somebody who was, you know, bleeding from here and there. And at that point, I couldn't understand, should I be running from the gun or should I be continuing to attend to this patient? So even that, like, when I sit back and reflect, like, in my mental health, is that really
healthy? Or,
you know, to try to process all of that, it takes time. So my message is, please, guys, whatever you've gone throughout this demonstration, even if it's that one tear gas, try to, you know, go back, reflect. If you need help, then take the help. But as an organization, with Future Pillars, we have started this program called Kicks for Mental Health or Kicks for Depression. And we started it with the best way that guys can relate to each other, which is through sports. So the easiest sport, I believe, for most of the Costarians is football. Yeah, we're not really that tall for basketball and other games, but hopefully we'll venture into those. But why we chose sports is because men relate so much with each other through sports. It's a safe place for them to feel happy, to get their endorphins up, you know. So it gave me a challenge. And we started this just at For Jesus ground. You're very welcome. By the way, next week we have another game with Swahili Pot. They're all friendly matches. We try.
We will join Mark 3 teams.
So we try to form a team, help them play. Last time, because it was the Men's Mental Health Month, and you know, because we're a startup, we're just getting started, I wasn't sure on what to really give to the men. I really felt like I need to give them something for them to be seen.
Yes.
So I partnered with CeraVe, which is a skincare company, to just reward them with something kidogo to, you know, lainisha their ngozi and everything, of which I believe men themselves have a problem.
Skincare routine.
Tunawapenda to give them a gift, but they didn't bother. Most of them were even showing me right there and then like, this is not for me. Shika anapatia dem mwingine hapo.
Americs.
So mnafaa kujiita mkutano as men, like ukipendwa.
Naangusha gangster point. Unakaa after 5 minutes unajipangusa. Start.
I gave them something so simple, which was a sample. In fact, it was just a sample to just, you know, feel like at least once in my life nimepaka mafuta kwa mwili. But still, you know, it's hard for you to love men the way you want to be loved.
Yes.
But yes, we will try as much as we can. In whatever way to show our appreciation. If it's words of affirmation, if it's gifting, you know, we'll try as much as we can. Because at the end of the day, we need these men. We cannot have a society without the men and the women. They are what make up this full society.
I think to pick up from this conversation is that women ni shingo na wanaume ni kichwa. So for kichwa to be right, you need to feed the head first, then the neck to be stable, to stabilize everything. So kwa vijana wenzangu, I think the men's mental health hapa tumeongelea, hatujagusa suicide, hatujagusa depression. Those are the last stages za mental health. So I think to pick up from this and words to take home ni kuwa jiangalie na uangalie watu ambao wako around wewe. So wanaume kwa wanaume, I think we relate much. So to wrap up everything, I think we need to create awareness. Kama uko nyumbani umesikia hii, mwambie mwenzako, mwambie mwenzake, jirani amwambie jirani mwenzake, na ndio hivyo tunasambaza injili. So without much ado, I want to thank you all kuja hapa na karibuni sana. It's Let's Fetch Podcast. Follow us on all our social media platforms, and I think maybe to say something ama kuaga our viewers, nasemaje?
Kuna tu point moja nilipomba ya wanaume na football. I love how men relate with football. Hawajuani hata jina. Bro, unaona amefunga. So like tuendelee venye hiyo football imetuweka hivyo pamoja. Tujuane pia tuko vipi. Hiyo saa tuko tu pale base tunaangalia futa. Tujue enyewe huyu msee wangu amekula. Uko poa bro. Venye tu hiyo mna relate sahi, sijui story Fabrino ama nikajaribu venye huyo anafanywa tu hizo maneno zenye anafanywa. Pia jua huyu bro mwenye namwita hapa ako fiti, ako sawa, amekula leo, demu wake ako poa, maybe hata demu wake ndo anamkula kichwa. Vile sisi tuko kwa red flags, maybe huyo demu wake ndo red flag. So to ensure we try our level best to communicate with our men, tujue wako vipi, and pia men kindly give us a simple and tuweze tu kuwa you be approachable, tuweze tukikuja tutafuta njia zote mfunguke. Na pia mkifunguka we'll try our level best as helpers, tumeambiwa we'll try our level best to make sure you guys are okay and to ride on smoothly. Lazima si tukisema marriage ni man and woman according to Christianity and also according to my belief. So tunataka tuwaone pale kwa aisle mkiwa tu sawa mpaka siku Mungu ataamua kutuchukua.
Maybe a word from you.
What I would say is men's mental health matters too. It actually matters the most, because if you have a provider who is not okay mentally, then the neck, like you've said, itaanza kuwobble, ihangaike, watoto pale kwa boma, everyone will just get distracted. So as much as we focus on these other things, men should guard their mental health. And at the end of the day, if it's so burdensome to share with your significant, your other half or your friend, there are other ways to, get in check. Start journaling. Find a healthy coping mechanism other than just, drug is a really an easy access, an easy escape. But at the end of the day, if you try to just accumulate the amount of years you've wasted yourself doing these other things when you could have been very productive, you'll just end up living with regrets. So if you just sit back and reflect on your life, I know it's a very challenging time. In Kenya, we are going through so many economic crises, and unemployment is a byproduct of all of this, but it doesn't mean that we should just give up and, resort to smoking, drinking and all. We should challenge ourselves to make that difference. So the men's mental health should matter the most.
Maybe Mr. Paul Tumbia, message to the young people, men, boys that are out there.
Yeah, I think also we need to champion this by different organizations to come up also with different initiatives that are able to speak about the same thing and also empower youth in different ways. Like I like Dr. Nur, what you're doing actually with the boys and football. That is great. RedCross actually, I know they're there to help, but I would like also you to come in handy just in involving more than just helping. Other organizations like us, we're going to be cycling. So if everybody will be doing something about mental health, I think at some point we'll end up getting it right also, because we're still trying to get it right in one way or the other. We are also new in this world of mental health being to this extent, because I think the times that we're living are also hard. So there's so many things that are causing the ripple effect to go all down to everyone else. And if all of us come together, come up with so many ideas, we will eventually be able to get ideas that are able to match, strategies that are able to work, and ways that are able to help us even to overcome this much better. Thank you.
So I think to finish up, I think sote tumewapatia mipango ama miundombinu ambayo tuko nayo kukusaidia wewe kama kijana na kama wewe kijana hapo nyumbani. So hii yote ni jukumu lako wewe mwenyewe kuchukua initiative, decision ni yako. So jipange na ujitambue na tuko hapa kukusaidia. That was my time. Amir.